and a good and a good rehabilitation program is associated with 50% decrease in depressive symptoms. A cardiologist can treat psychiatric problem. If it is a good rehabilitation problem, we will take the credit. Our patient will improve. He will recover from depression. So, at the end, for a patient, depression is bad for his heart, and my bad heart is bad for my depression. So, how depressing is that? Thank you.
And what are the medicines for the cardiac?
Yes, sir. Now they have found out that sertraline they recommend all cardiologists, and also the dianeptine. Dianeptine is very safe for all these cardiac patients. Sertraline is very safe. These two medicines blindly all physicians and cardiologists can prescribe whenever a patient comes with any depressive symptoms.
Renal shape also, sir.
Renal safe is dianeptine. Sertraline also relatively safe. Sir, with your subject. You can come and from here you can give. Yeah, better because you can come here.
तो सामंतराय 2 पोस्टर यहाँ पर भी घुमा देना.
Good morning, Dr. Roy sir and my senior colleague. First of all, I thank you, Dr. Samantaray, for giving us such a igniting us for again such a interesting topic that really generally we are ignoring. But last 2-3 years we have a lot of discussion in several times that most of the cardiac diseases, when we are getting later on in either in depressed mood or in later on a presence of sense of some anxiety related neurotic depression. Today he has already covered one part for particularly the depression patients. Huge study as he has shown. But mainly two things arises that why first one group, whether which personality group is getting the heart disease. So I would like to highlight particularly that the personality of the general society has been divided in 3 groups, A, B and C. And now in one recent they have added D. So type A personality, most of the society you are getting. What is the characteristic of that? How to that is a type A? These people are good achievers. They want to achieve more. They are very much always in shortage of time urgency. Then they have a tendency to achieve sometimes angers, sometimes their frustration. They will show their body psychomotor activities will always give you some clinch that they are in type A personality. Then B equally second, the vice versa. They also achieve, but they remain in very cool and calm life. Whatever God has given.
And I have identified I have a type A personality.
Second, C equally mixed, and group D just recently that has been seen that they are the personality, they are always trying to keep socially inhibit type. They are not wanted to interact with people. They want to, if they will get leisure time, they will remain want to inside. So social inhibition and that. So D type of is the good material for research for us. That this type of personality, and A, of course we all know that A are more prone for having cardiac events. D is equally events. So these two personality, these are some genetic trait and there are some environmental trait or their upbringings or in social life. So these patients are having more prone for heart disease. Second, that depression may occur prior, as I have discussed. Depression is, as he has described, not always with the less mood, sometimes the aggressive mood, also with the depression. So this one event, one patient's group, those having the heart attack, and after the heart attack, these people are more prone for going on major and minor depression. This subset of patients we are regularly watching that particularly young male, geriatric women and young women are little bit away from this trial. But young males, those who are having cardiac events, they are major going for the POD. And this was proved by SADHART trial, very famous trial for us. SADHART trial, as here you have already described, this is the basically certainly major drug that drugs has been tried for major depression outcomes. It was a double-blind trial and outcomes was very good for those who are having the major depression and they have been prevented. But some sort of minor depression remains. Whole things is that it is a well truth that depressions and cardiac events have the pathophysiology that it is a depression is due to high adrenergic activity, high cortisolemia, high heart rate, less heart rate variability and leading to cardiac uninjury. So this is the pathophysiological event for the depression and so it is a fact. In general sense, all OPD patients, whole worldwide study was done. 40% has been related to somewhat psychiatric problem, related to minor depression or those attending. Because if you screen the 100 patients you are attending, you may get that 20 to 30% patients in OPD, particularly service, came for without having no problem. So worldwide, if 5 crores is coming, among 40% are having somewhat sort of activity. So it is a very well-known fact. We have to live with it. But whole good things is that we have a plan to implement cardiac rehabilitation program, and we are trying to for 2-3 years to give them lectures and to advise them to lifestyle changing. We are training routinely as our professional work to rehabilitate them in job, a guard, driver, security, heart attack patient. We are regularly rehabilitating them. But rehabilitation, cardiac rehabilitation is an outlook. Last 3-4 years in Slovenia, we are gradually publishing in that our future plan is to establish a well cardiac rehabilitation center. Whether what we are doing, it is a teamwork of 5-6 persons. Whether after the events, when they are coming in follow-up, 3-4 persons should gradually counsel them, rehabilitate them, and try to know what compliance is, and gradually among them in the heart specialist, general psychiatrist.
A psychologist and a psychosocial worker is a must. Psychiatrists, they are not available everywhere. But a psychologist and psychosocial worker is a must for any cardiac clinic. They must appoint a psychologist and psychosocial worker.
40% of outdoor patients you said were generally related to some kind of
Depression.
disorder. But what is the ratio of the general? What is the the general population, not outdoor population? General population, if there is some study of how many
20%.
It has been found out by WHO that 25% of people have some or other psychological problem.
general people.
General population.
20%, sir. So we have to live with it. We have to live. That's not a major problem. But this rehabilitation program, I hope, sir, by the leadership of Dr. Roy, will start this clinic on paper of coming first of this session, April. That will make it as a mandatory for our fix our time, 2 hours in a week, and we'll enroll them. And this will be the first time in Indian Railway. Even Perambur don't have. Last time, Madam Gita has come, and the cardiologist who investigated after seeing our infrastructure and doing all the data, they are saying, why not you are doing this? They have done in Madras Medical College. I told her we are regularly practicing this, but we have to do it on a registered and make it as a mandatory to enroll them, and we'll do it. Definitely, I hope we'll continue for the next outcome, because it is easy, nothing, by only 2-3 hours and enrollment, and through our team is already here, we can see and enroll for this. And hope, and regarding what drugs, what not to prescribe. All the tricyclic antidepressants, amitriptyline, all the triptyline has gone. So we are.
You have to just remember you can prescribe sertraline and dianeptine. These 2 drugs you should not bother your head. Just remember sertraline and dianeptine are safe for us.
It is
Also kidney.
It is the say and try.
Oh, Stablon is Dianeptine. Stablon is the company name. We will not ask for that. Dianeptine.
And your this all the tryptylene, amitriptyline, and this is a very bad for the your because of the bradycardia and arrhythmias. We are not prescribed. Thank you, sir.
Hey, Dr. Samantaray, what you have told today, particularly in one subject, but I think that any chronic disease, it is applicable to this kidney or it is this COPD.
Neurological problems.
So it may be one-sided effect of this heart, but it is applicable to any chronic disease
Any
which
chronic.
will produce the depression.
Any chronic. Thank you, sir. इसको बंद करो भाई.